All right, welcome back, everybody. So, as you know, there's a lot of stressors going on in our world these days. Fires burning across California, the Valley Fire here locally. School is back in session for most people virtually, and then our COVID-19 numbers are on the rise. So, it's not easy to stay healthy during these challenging times, and that's why we have our expert, Dr. Abisola Olulade. She's from Sharp Reese Steely Medical Group, and it's so great to have you on with your insight. Good morning to you, Dr. Abby. We want to talk about helping people stay healthy. And, you know, the most immediate thing this morning is that we're waking up to another day of smoky skies, it looks like. So wildfires. What should we be doing during this time?
Yeah, so it's really, really good to see you too, that I know it's been a while. So when it comes specifically to the wildfires, you definitely want to pay attention to the air quality. You can use visibility as a guide to that. So if you can see it 5 miles away, for example, or 1 mile away, so that can inform you as to what you need to do. And you can also look up, of course, this on the CDC's website. But if you're someone who has asthma and respiratory conditions, then you may want to avoid exercising. Also, very young children, you may want to avoid being outside, and you should also take care of those chronic respiratory conditions in preparation, just in case. So taking care of your overall health and your chronic conditions is always going to be very important.
Yeah, we've already seen the worst fire season as far as acreage in California, and it's not even, the heart of fire season yet. I know it's year-round for us, but it's the beginning. So, of course, that can stress people out. You see the video of fires in our area, and it just causes, a little increase in the heartbeat, I think. Let's talk about stress. How do we handle this? I mean, what should we be doing when we see images like that and when we hear about what's going on?
Yeah, so, I think that, first thing is that, you should try to avoid, constantly, looking at them and constantly watching, these images. It's really good, I think, to watch local news because it's on intervals, instead of a constant, cycle. So I think that is good. And making sure that you're checking in with yourself in terms of your mental health. So most of us have experienced a seismic change in our lives, and change, even when it's good, can be stressful. And part of it is also the uncertainty. So the uncertainty can be very destabilizing. We don't know when things are going to end with the coronavirus pandemic, and then you have wildfires on top of that. So it can really seem that everything is going wrong. But trying to put things into perspective and acknowledging that is very important.
Okay, checking in with yourself, so important. And of course, now that the school year's begun, so many parents trying to help their kids learn from home, logging on. And what are your biggest health concerns for this new school year? I mean, what do you think people might be facing and going through now?
Well, I think, just the pandemic fatigue is a big one. The fact that there has been this change, and now a lot of students are virtually learning, the stress on parents is a big concern, and also the stress on children. But we all have to remember that change, although it can be tough in the beginning, over time, you can really learn resilience and you can adapt, and children are very resilient if we support them and give them the tools to help with this. So we want to make sure that they are also exercising. We want to make sure that they're taking breaks, they have the proper posture if they are virtually learning. And if they are in school, then talk to them about the fact that it is different. It's not the same. Things are going to be different. You're going to have to wear masks. You may not be able to share things, but engaging with them is very important. And also taking care of yourself, because kids really do look to adults and model their behavior a lot of times. So taking care of yourself as a parent, as an adult, is important also.
Yeah, very important. And then what about with, the coronavirus now? It's been many months now. We are seeing lately rising numbers here in San Diego. I know we were doing good for a while, but do you have big concerns with that? I mean, what should we do about this now that we're starting to see that little uptick?
Yeah, I think that, most of us, going into Labor Day weekend, we're a little bit concerned, again, seeing those images, of people, not social distancing and at bars. And, there is a worry because of what we call the incubation period of this virus, which means that from when you've been exposed to when you actually show symptoms or test positive, it can be up to 2 weeks. So we may see an increase in cases like we did on 4th of July and with Memorial Day. And again, it all contributes to that fear, the anxiety, the uncertainty. Our business is going to close again, so, we have to continue these measures and not get discouraged, but, wear a mask, watching your distance, washing your hands, doing all of the things that we know will continue to help us stay open is going to be very important.
Dr. Abby, thank you so much for sharing your insight. It just helps me feel calmer when I hear you, so we appreciate it. Good to see you again this morning. Thank you. All right. We'll send it over to you now.